so much for joining. Thank you for joining us today for the information session on digital health literacy for general practice. The purpose of today's session is to introduce you to the upcoming series of workshops that the Gippsland PHN has commissioned, aimed at providing training and support to you all to expand your knowledge in the use of the digital tools available to general practice and how you can use them to maximise both efficiencies within your practice and achieve best outcomes for your patients. So I'm aware we only got 20 minutes for the presentation, so I will slip through quickly if I may. So the aims of today's session, obviously by the end of today, you should be able to fully understand the range of digital health tools available to the GPs and practice staff within the Gippsland Primary Health Network and the benefits that they bring to your general practices, and also to improve opportunities within your practice for targeted learning by identifying the most appropriate person or staff member to attend these sessions to get the most out of it. So I'd like you to be thinking about that while we're going through the presentation. Who do you think would be the most appropriate person in your staff to actually attend these sessions? So the aims of the Gippsland PHN in providing the digital health literacy training package. Gippsland PHN is committed to supporting and building the Gippsland healthcare workforce's confidence in the adoption and embedding of digital healthcare. The One Good Community General Practice program has been developed to encourage general practices to develop capabilities and to utilise digital tools and technologies. It will embed the use of digital health tools in your general practice and support practices to implement or improve existing models of care. This improvement aims to impact positively on the health and well-being of Gippsland community, and Gippsland PHN have engaged LADA to assist in the uptake of these tools through a series of training workshops aimed at informing and supporting the practices in the use of the current digital tools. So as you can see, the aims are to build the confidence of the health professionals to deliver the tools that are available, but also to provide you with the knowledge, the technical knowledge needed to actually ensure that the tools are used efficiently in your practice, and of course to improve the capacity of the practice to deliver the enabled models of care. Hope that all makes sense. So looking at what's available to you, the PHN has a vast range of digital tools available to you, and it's fantastic what you've got. For the purposes of our training session, we'll only be focusing on some key areas. So the areas that are highlighted in yellow are the ones that we'll be focusing on. And I'd like to give you just a little brief overview of what each of them are to ensure that you're aware of what they are and how they can improve performance in your practice. So of course, the first one, secure messaging. This enables safe, seamless and secure exchange of clinical information between healthcare providers. It supports a secure delivery of messaging containing clinical documents and other information between healthcare organisations. The benefits of secure messaging is that the message is encrypted and by the sender and needs to be decrypted by the receiver. And the security used is through your NASH certificates. It does require registration with one or two message providers such as Argus or Health Direct, because traditionally we've been using faxes or more recently emails. I think originally it was posting, but then we got to faxing, and then of course we've transitioned to email. But now secure messaging is definitely the way to be processing your documents, particularly with clinical information involved, because the other methods have no security. It does give you access to the National Health Services Directory when you are using your secure messaging service. So it does allow you to expand your contact database. But the benefit also is that there's a mandatory acknowledgement. So you actually know that your referral or your clinical information has been received. And of course, without a doubt, one of the most significant improvements is practice efficiency. So your staff aren't scanning or faxing or posting documents. That's all done with a click of a button. So that's your electronic or your secure messaging. Polar is the cloud-based clinical intelligence platform that uses data extracted from your clinical and billing software to support quality improvements and internal operations within your practice. I know most of you have access to Pola, and from my recent visit down to Gippsland, I did note that the practices that I dealt with in November, a lot of them aren't using Pola. So this is an opportunity, if you don't use it, to actually learn how to use it and how it can improve the efficiencies. It helps practices to understand their patient cohort and respond to patient health trends. It supports quality improvement, and it helps you to identify at-risk patients or clinical indicators. It tracks patient outcomes and, of course, improves data quality, and allows you to review your MBS revenue and also to identify potential revenue within your practice. So, brief overview of what it is and what it can do for you. My Health Record is probably the most well-known health initiative or digital tool at the moment, because we've been using it for, I think, since 2016. So I guess it's about what capacity does your practice use it. So My Health Record is a secure online summary of an individual's health needs. It's accessible to the patient and their healthcare providers. It permits healthcare workers to share patient health information with other providers, and consumers can access their details through their MyGov account. It can be accessed by other providers, so it allows things when there's hospital admissions or unexpected events occur that someone else can actually access the manual, the compulsory information that's provided within that summary. It does include things like basic information, so allergies, current medications and immunisations are included, which is a benefit particularly for allergies if you are travelling or you have an unexpected hospital admission and are unable to communicate your allergies. And health summaries only, as I said, only include basic information, and the patient is responsible for the information that is uploaded. Then we have the Digital Health Guide. So we're, again, a web-based platform providing high-quality information to healthcare providers about mobile health apps. So we're in a generation where mobile apps are the go-to. We no longer give patients handouts because they chuck them in the bin on the way out of the practice. The younger people particularly want access to apps that can help them improve their health outcomes. So GPs need to be on board with what apps are available and ensure that the apps are suitable for the patient. So it allows you to actually look at the apps, see what's out there for you, and actually recommend some apps for your patients. So a really good program, which is very underutilised. So the benefits, obviously, to quickly understand a patient health app and the ability to prescribe a trusted app to your patients to reflective of their needs. Oops, sorry. E-prescribing, obviously that's another one that we have had thrown at us through COVID-19. So obviously COVID-19 hit, so e-prescribing was rolled out a lot quicker than the government initially intended to, but hasn't it been a goal mover or a life changer? It's been significant, has a significant impact on the ability to provide medications to our patients while we're conducting digital, so the telehealth and telephone components. So as the word explains, it is an electronic prescription, enabling the prescriber to dispense and the claiming of medications without the need for a paper prescription. Tokens are sent via SMS, email, or as a printed token to the patient, and as I said, is beneficial when you're conducting telehealth. It's improved efficiencies and reduced prescribing and dispensing errors. And it removes that need for that paper script, which we always lose. It does maintain the privacy and integrity of personal information. So it's really been a life changer, and I find that GPs use this very well. So if you're not using it, it's certainly something we need to be looking at getting up and running in your practice. The Gippsland Health Pathways, obviously another online portal designed to be used by healthcare professionals at the point of care. So when the patient is sitting in your consulting room, this is where the ideal time to access that. It provides best practice assessment and management of common medical conditions, including when and where to refer your patients, and it promotes consistency of care and best use of resources. It presents a synopsis of current evidence and clinical guidelines, along with local referral options, and it's tailored to reflect the local options, tailored to reflect the local community. and it does encourage collaboration between healthcare professionals. So again, another great tool that's very underutilised. I know some practices are using it in Gippsland, but not a lot. And finally, the last one we touched on is the Health Direct video call service. So obviously this is similar to the platforms we use like Zoom or Teams when we are engaging digitally with our patients. This is secure and reliable video consultation. The benefit of this is that it does not require the patient to have Zoom or Teams or GoTo or any of those platforms. It allows us to send a link to the patient with the appointment details. The patient then clicks on the link. We are advised that they have entered the waiting room and the GP can start the consultation from there. So obviously a really quick overview, but it does integrate with your practice software. So if you're not using it, and I think it would be a great opportunity for you to learn how to use it because it can actually improve efficiencies. And as we all know, a lot of our telephone item numbers are now, or the digital health item numbers are only for telehealth. So we can do a few items through telephone, but if we want to be able to access the full range of Medicare items that are available, digital or telehealth is the way to go. And this is a great platform, and it has been funded up until June 22. So the PHN is able to provide it to you free of charge because the government has increased or extended the funding till June 22 at this stage. So hopefully that will extend on past that date. So that's a brief overview of what we're looking at. Obviously, how are we going to do that for you? So we're going to be conducting a series of relevant training for you on 2 levels. So foundation level, obviously, is for people who are new to these programs, who don't feel they have a good grasp of it. And then we have the intermediate level, which is designed for people who have a little bit more knowledge of the programs, but just want to fine-tune their skills or learn more about what's available to them. You may have accessed the platforms on a certain level or would like to step up to that next level. So the training will be structured around the 2 levels, basic or foundation and intermediate. Obviously, the target audience is dependent upon current or potential use. So if you've used it in the past, you're going to be more focused on the intermediate. However, if you're new to it, you probably look to start with the foundation and then move across to the intermediate. So we do hope to have something for everyone. The sessions will only be 30 minutes long, like today's session, because we are very mindful of life in general practice at the moment, and we don't want to be taking you away from your daily duties. And of course, we've split the time between a 1 o'clock or a 6:30, depending on who's attending. Clearly, GPs, a 1 o'clock session is not going to work for them. So that we're hoping by providing the 6:30 session, it will give the GPs the ability to attend. And each of them, as I said, there will be an overview of each of the technologies that we are presenting for you, the benefits of use, a demonstration of the function, and of course question time. So they're very simple, supportive, and focused on the digital technology that we'll be addressing. So these are the dates for the foundation level sessions. So as you can see, they're spread every 2 weeks, and we have grouped some of the training into 2 topics. So the first one, My Health Record, will be a standalone because that's I believe that's a really important one for both GPs and practice managers to attend. And then we have grouped the rest of them into groups of 2 to provide as much information to you in a shortest period of time. Otherwise, we'd still be doing presentations at Christmas time. So, hopefully that works for everyone. And there's the intermediate level session. So they will be sort of structured between foundation and intermediate. So there basically is going to be 1 presentation every week for you to attend. This information is available from the PHN. They'll be providing you with the details of the sessions and what's included, and the ability to obviously register with those. So attendees and registration, as I said, foundation series is for the introductory level only and would suit administration staff who are new to this technology. The intermediate series, of course, will be for those people looking for further information on the advancement of their use. Registrations, as I said, will be promoted through the PHN, and your staff could register via the registration links. What I would like to spend the rest of the time doing, if I may, is we have invited you all today because we want your feedback. we want to know what it is that you would like to achieve from our training. So, and who you believe would be the most appropriate person for your to attend this session. So I'd like to invite you on, if I may, anyone who'd like to turn their camera on, because we do need your input. We don't know what you're looking for. So I would hopefully invite someone. I'm going to stop sharing my screen, and I'm going to ask anyone who would like to please pop their camera on and have a bit of input into what we're talking about. So would anyone like to kick off? Mario, would you like to kick off?
It's good to see everyone again in Gippsland. We've been working very closely with the PHN to try and tailor make this this training series for you. And one of the ideas we came up with was to have this introductory session. It was more about the idea of introducing the concept of what this training is going to involve, and to be able to then really get your feedback, because one of the things we really wanted to do, and being an ex-practice manager myself in Gippsland, if I had the opportunity of attending a training session like this, I know for myself that I personally wouldn't be able to firstly attend every one of these sessions, and secondly retain all of the information that I'm going to try and collect from here. So really trying to identify those key people within the organization who you think are going to be critical in this, whether it be the lead nurse, whether it be a clinical support officer who sits in the administration team but does a lot of those recalls and reminders, and really wants to try and, you know, upskill their expertise to be able to step up in their career within the clinic as well. It's just looking for those opportunities as to who we can actually extend and stretch that little bit further to be able to you know, step up, especially because we are human. Practice managers also need time off. We also need to get away from our clinic sometimes, and to be able to know that there's someone there in the background who can take over for a couple of weeks while we're on leave is really, really important. So just having that in mind is really important. And the other one, or the other aspect that we wanted to try and cover as well, is that our GPs are so crucial to all of these trainings, because they're so heavily involved in the digital health tools that we're looking to use or train on. So really, again, thinking about who can be a GP in the clinic who can champion this. So we're not asking for every single GP from every single clinic to attend, but if you know that there is particularly maybe a registrar or a young GP who is keen on digital health tools, maybe getting them to attend, and then holding a clinical meeting within your own clinic to be able to then, you know, replicate that training specific to your own clinic needs. So that's just my 2 cents. I'm going to mute myself because otherwise I'll keep ranting on about it.
Thanks, Mario. Yeah, I agree. I think I know myself in my practice, I have a couple of admin support staff who I would easily trust or would welcome their participation in this, because I know that they would take the opportunity and run with it. So I think that's what we're looking for you, or hoping you'll target on someone that, whether it be yourself, but we are again mindful of how busy you are at the moment. So we don't want to give you one more role to do, but I think it's something that needs to be ongoing. So it needs to be someone that you can trust or know will actually take this information and then target the GPs or the appropriate staff to make it work within your practice. So would anyone else like to have some input, any suggestions, what they think would work well for the training module? So I've given you a brief overview of what's going to be involved. Is there anything you particularly like out of each of those sessions that might help you to learn more? No? That's okay. There's a lot to think about. So I'm hoping that you will spend the time after today's session and actually have a think about who in my practice would be the right person for this training, whether it be yourself, and then you actually then delegate it to someone else. If you intend to do that, I think it would be really beneficial for both of you to attend the training. So you as the practice manager obviously drives most programs in your practice, so it would be worth you having that background knowledge, but then inviting the person that you choose as your champion, as Mario put it, to attend as well, so that you've got two people who are aware of it. Yeah, I really hope that you will. I think it's going to be a great training session, and it's designed to, as I said, it's designed to be user friendly. So it's not going to be a training session where people will feel like, oh gee, I don't have no idea what they're talking about. It's simple, it's straightforward. I work in general practice, so I know what it is that the GPs particularly will want to look. They'll want the quickest way of doing things. And as PMs, it's important that we have a way of improving our efficiencies. So I noticed, Angela, there is some chat, some questions. Would you like to have a look at that, or is there any questions that I can answer?
So the main question, well, the only question we've got in there at the moment, and that's a really good reminder, if anyone doesn't really feel very comfortable speaking, feel free to pop any questions you have in the chat, was just, can we please have a copy of today's slides?
Yeah, of course, absolutely. I'll send that through to Angela, and she can distribute it to anyone who'd like it.
Absolutely.
So, yeah, no, that's great. I'm glad someone wants them. Susan, you're looking lovely there. Do you have anything you'd like to say?
Can you unmute there, Susan?
Sorry, that was my question. Can I have a copy of the slides? But today's my second day as practice manager, so I'm
welcome.
You can imagine my head at the moment, but being an ex PHN / Division of General Practice.
Oh yeah, that's going back, isn't it?
Very proactive about all this sort of stuff. So I'm very keen to implement some things into the practice. Yeah, so there's lots of exciting things and challenging things to work on in practice.
Yeah. But I think digital health is certainly the way of the future. Look how far we've come in the last 2 years, and not really because we wanted to, because we had to keep up. So we had to transition to digital health tools to allow us to keep doing what we're doing. So it's only going to get more and more. I know that this year the government has announced the next 5-year plan for digital health. So they're looking at input from general practice. Actually, they're looking for what do you want, what's next, what would you like to see us improve on. So I know that that's going to be more, there's going to be more and more digital platforms for us to access. I think if we can hit the ground running and get familiar with what's already available, it's only going to extend our knowledge when they introduce new platforms for us to try. So
I think COVID has given us a real nudge to what we can do, you know, in health and in education especially as well.
I agree, Susan. If you told me 3 years ago that we would be doing phone consultations for our patients and we wouldn't be laying people in and we'd be doing electronic prescribing, I'd be like, not in my lifetime. And look, here we are.
Yep.
We've got it running perfectly.
Yeah.
Tanya, you're looking like you'd like to say something. Hello, would you like to pop and say hello? No? Sorry for putting you on the spot. Thank you for having your camera on. It's nice to see faces. So look, I think if no one else has any further questions, what I'd like to do is just get you to go away and think about what we've talked about today and see what you think would be a benefit to the training, and feel free to feed that back to the girls at the PHN, who will then feed it back to us. I hope that we then can cater the training to your needs and for you to get the most out of it. So if anyone else has any more questions, now would be a great time. Otherwise, I'll hand it back to Angela to finish up.
I see Mario's got his hand up there.
Yeah, I just wanted to.
Help yourself, could you, Mario?
No, I just couldn't. I really couldn't. But it was more just the fact that if there is anyone who's just even wanting to reach out to us via a one-on-one consultation, we are offering that as part of this, just to be able to, you know, spend 10 minutes with you on the phone, just to try and get an understanding as to what you're specifically looking for. It will either be myself, Wendy, or Marianne, who is also in the group of attendees today. So Marianne's one of our colleagues, and so what we would do is just simply call you, ask what you're specifically looking for, and I think what we'll probably get is more feedback after the introduction sessions are done. So we fully understand that, but yeah, really for the intermediate ones where we're hoping that the GPs will attend, you know, we'd really like to get your feedback then. So that's it.
Would they be best, Mario, to email us, or do they contact the PHN and then they'd provide us with those points of contact?
Yeah, I think that would be the best way moving forward, just to keep it nice and clean. And ultimately, there might even be things that the PHN can triage directly, so it wouldn't necessarily use up our time. So not to say that we don't want to talk to you. We'd love to talk to you, but
Oh, yeah.
I know if I get on the blower with someone, I'll probably be there for the whole day. So
Yeah, maybe address it to me.
yeah.
But yeah, I reinforce, Mary, as well. I'd love to hear from you either via email or to your PHN, and they'll forward the information to us, and we'll then contact you to discuss anything on a one-on-one basis. That's absolutely happy to do that.
Fantastic. I have just popped my email in the chat. So if anyone does think of any questions or ideas after this session, please feel free to send them through. Or if you do want anything else, feel free to send that through. Thank you so much, Wendy, for a fantastic session. It's been really good to hear about what the sessions are going to be about and the different levels. I think that does us for today. So I'll let everyone go and hope you enjoy the rest of your day. Thanks,
Thank you, everybody. See you later. Bye-bye.